Morning. As per our schedule, we already covered introduction part and then we saw RCM cycle in last session. So in today's session, we are going to cover CMS 1500 claim form. As we saw here, there are two claim form. One is the CMS 1500 and one is the UB04. UB04 claim form is used for hospital billing and CMS 1500 form is used for the physician billing, and we are going to focus on physician billing. So it's very important to know about the CMS 1500 claim form in very detail, because whenever we'll start our work in any company for any client for any state, every day at least for 30 times we are going to open the CMS 1500 claim form. Okay, some important uh, fields are there, and that needs to be remembered because it's a part of your interview everywhere. They will ask you some important boxes from the CMS 1500 as well. How it look like? Let's see. Okay, so this is the unique claim form uh, designed by US government. Okay, it is approved by National Uniform Committee Claim Committee, and everyone have to use this claim form all over US. Everyone have to use this claim form. Uh, Insurance company cannot design their own claim form. In every state, for all the provider, for all the insurances, for especially for the physician bill, if somebody want to send a bill to insurance, then they have to use this claim form. So every single claim form will be the unique claim form because there is a barcode, and this is not a free of cost. If we want to send a electronic claim form, as we know, to send the claim form, multiple options are there, right? Electronically, paper, fax, upload on the web portal. So most preferred way is the electronic way. And to send the electronic claim form, there will be a charges of $4 to $5 each claim. And if we want to send this claim form through paper, that means the hard copy of the claim form. So the blank claim forms will be there under the printer. And whenever you are clicking on billing the claim through paper, it will get printed, and someone at our client side, that person is responsible to send it through courier company to insurance company. So that hard copy of the claim form is charges for that is 18 to $20 per claim form, and your courier charges will be different, 40 to $60 depend on the distance from our hospital to insurance. So that's the reason everybody is preferring to use the electronic way to submit our claim form. Okay, so this CMS 1500 claim form is having 33 boxes. Okay, and what is meant by CMS? So Center for Medicare and Medicaid Services. Okay, that you have to remember. So you can make one copy. Every day we are seeing new topics and some abbreviations will be there. That means the long form you have to remember because interviewer will ask you in short. Example he ask you about the ABN. So you should know first of all what is meant by ABN. So it's advanced beneficiary notice. So like that, you should know the long form. Then only you can able to answer. Okay. So the CMS is Center for Medicare and Medicaid Services. So this form is having total 33 boxes. Okay. And from these 33 boxes, at least you have to remember 12 to 13 boxes. Okay. It's very easy every day if you are reading the notes, and it's not hard to remember. So let's see. You can see right side portion. This form is segregated into three portions. Okay, first is the carrier, second is the patient and insured information, and third is the physician or supplier information. Okay, so one by one we'll see. Carrier means what? carrier means I'll create one additional note. So some additional point every day I'll mention here. So what is mean by carrier? Carrier means insurance, also called as payer. Okay. So here carrier information, that means the insurance information will be there, like address will come here. Okay. And easily we can identify to which insurance we have sent the claim form. This is the sample claim form. That's the reason we are not able to see. But actual claim form in the applications, if you open them, some insurance name is there, like Tricare, and their address will be there. Okay, some barcode and all like this. So on the basis of that, we can easily identify where the claim was sent. So good morning. Uh, we have started today's session about the CMS 1500 claim form. Okay, you can go through the recordings for just started actually, not much covered. So don't worry. So this is the claim form which is used for the physician billing, and it is having 33 boxes and important 12 to 13 boxes you have to remember. It's a part of your interview questions, and it's the easiest question. We should not miss if somebody is randomly asking you 3 4 boxes. Okay, it's very easiest question. So if you are reading the notes, or if you are sticking this by printing, if you are sticking it on your wall, and try to remember at least 12 to 13 boxes, then you can easily answer for that easy question. Okay, so there are three portions for this claim form. One is the carrier. First portion is the carrier. Second is for the patient and insured information. And third is the physician or supplier information. So carrier means insurance, also called as payer. So here in first portion, insurance information will be there, and also there is one barcode. That means every single claim form will be the unique claim form. Okay, we cannot use the same claim form for multiple patient or multiple date of services for the same patient. Okay, for every time we have to use the separate or the different claim form. Okay, so there will be a charges for electronic claim form. $4 to $5 will be there. For paper claim form, $18 to $20 charges are there. Okay, so let's see. The next portion is the patient and insured information. So what is meant by insured? Insured means policy holder, also called as subscriber of the policy. Okay, so it is having total 33 boxes, and this second portion, patient and insured information, is having two separate portions. Left side for the patient information, and right side for the subscriber information. Okay, so I'll tell you the important boxes, and which boxes we can ignore, that also I'll tell you. Okay, so box number one is having some insurance names, like you can see here: Medicare, Medicaid, Tricare, Champa. As I said, this is designed by US government, and it is approved by National Uniform Claim Committee. Okay, so this box number one is having some insurance names which are provided by US government, and everybody is not eligible to get the insurance. There are some eligibility criteria to get US government insurances. Okay, So this Medicare, Medicaid, Tricare, Champa, Group Health Plan, FECA, Black Lung, all these are provided by US government. And at last there is a box for other. That means any other insurance, if you are sending the claim form, then uh, it will get checked. So remember, on directly on the claim form as a AR or any department, we are not doing any changes manually. Okay, actually we are doing changes in the application, and whenever we are billing the claim, that information is going on this claim form. Okay, so box number one is having some insurance names. Box number two is the patient's name. So in US, name format is different. Name format, not like the India. Okay, so you can see here last name, first name, and middle initial. Last name, first name, and so example, if I am writing Adam Smith J. So Adam is the last name, Smith is the first name, and J is the middle initial. Okay, so we should not get confused how to tell to the insurance representative. Whatever is showing on in the application, just read like that. Okay, if you are working for any patient, how the name is looking into the application, or maybe you can open the policy ID and then you can uh, pronounce like that. Okay, no need to confuse. Okay. So I'll write here Adam Smith J. Box number three is having date of birth. Okay, so date format is also different. It is MMDD. In India, we are using DDMM. Here it is MMDD. So in case if you have started to call to the insurance, and if somebody is asking you the date of birth or the date of service, any kind of date. Okay. So example, this is the date in application. You should not read this date like 7/9/2025. That is the wrong. If you are telling them uh, 7th September 2025, that is also wrong, because first is month. Okay, that's the July 9, 2025 is the correct date. Otherwise, they will say that there is no claim on file. Okay, so this is the date format all over US. Everybody is using MMDDYY 7/9/2000. Next is the gender under the box number 3 only. Then box number 5 is having patient address. Might be possible that the policy holder or the subscriber and the patient is same or different. If it is same, then address will go same under these boxes and these boxes. If the patient is staying somewhere else and subscriber is staying at different address, then the patient address will go here. Okay, it is having the street, city, state, zip code, telephone number, and all. Okay. Box number 6 is having patient relationship to the policy holder. Okay. So maybe the self, as I said, then the spouse. If the policy holder is the husband and the patient is wife, then it will go as a spouse. If the policy holder is a wife and the patient is husband, then also it will go as a spouse. Then for the children and other means sister, brother, parents, that time it will go as a other. Box number 8 is reserved for NUCC, National Uniform Claim Committee, so we don't have to worry about. Okay. Important boxes I'll tell you which needs to be remembered. Box number 9, other insured information. Okay. So you can ignore this box. Don't worry. Nobody will ask. Box number 10 is patient condition related to. Okay. So due to what condition patient came to hospital? Uh, okay. What was the reason for patient's condition? maybe he got injured or illness at his workplace, then that time it will get checked as a employment. Okay, or else it will go as a no. If he got accident on bike or car, then it will go as a auto accident, or else it will go as a no. And in any other case, it will go as a yes under other accident. Okay. If it is not accident, then it will go as a no. That's it. Box number 12 is uh, just the patient's or authorized person's signature. So remember that we cannot use any pen to write anything on this claim form. Everything go as a digital signature. Okay. So someone from the patient for family or the patient have to sign this claim form digitally. Okay, and when it has been signed, the date will go. So from these boxes, just have to remember only one box, that is the box number 1, which is having insurance names. Okay, all other boxes are not that much important. Box number 2, sorry, next box are for the insured information. These boxes are for the insured information. So insured ID number, that means the policy ID number. Okay, so whatever is mentioned on the ID card, the policy ID, that will go here. Then the insured name, here also the format is last name, first name and middle initial. Insured address, whatever address will go. Then insured policy group or FECA number. So what is meant by group or FECA number? Sometimes policy or the plan is the group plan. So whenever we are seeing the ID card, on the ID card sometimes group number is given. So here you can see this is the sample ID card for UHC, and you can see here the member ID. Member ID is nothing but the policy ID or the subscriber ID. Okay, so whenever you are calling, that time maybe you will face this. Some representative will ask you the member ID, some will ask you the policy ID, someone can ask you the subscriber ID. All are same. Okay, so this is the member ID or the policy ID, and in front of that group number is there. So one field will be there in our application where the group number is added according to the ID card, and it will go in this box number. Okay, whatever is group number, it's not mandatory box. Okay, if it is there, then only it will go. Some plans are the group plans. Okay, in that case, group number will be there. Okay, so ensure date of birth and the gender and all other boxes under this are not that much important because they are other claim ID and insured plan name, program name. Let it be. We can ignore this. And here also we are having box number 13 for the digital signature of the subscriber. Okay. So from these two portions, only two boxes you have to remember. Box number 1, that is the insurance name, and box number 1A is the insured insurance ID. Okay. That's it. Now next portion is for the physician or supplier information. Okay. So what is meant by supplier? Supplier is nothing but the provider, nothing but the doctor or hospital. Okay. So who has supplied the service? Their information. That means the doctor's information will go here in this portion. So many boxes are there which are important, need to be remembered. So box number 14 is date of current illness, injury or pregnancy. It's not mandatory that if the patient came today to take a service, he got injured or illness from today only. Because as you can take the example of ourselves, if we got injured or we are not feeling well, we are not directly going to the hospital. If it is not emergency, we are going to our family doctor. Okay, we are taking first treatment from our family doctor. Okay, the basic services. If it is a critical, then our family doctor itself will refer us to go specialist or the hospital. If it is not critical, then our family doctor will provide us some prescription and we'll take that. If for next 1 week also, after taking the prescription from family doctor, we are not recovered, then in that situation what we'll do, we'll try to visit specialist or the hospital. Okay, so the exact date from which date he got injured or illness or the pregnancy date, that date will go here. Okay, so that is the box number 14. Box number 15 is other date. So I never use in my career, so you can ignore the box number 15. 14 is important. Box number 17. Okay, let's see. Box number 16. So it's a dates patient unable to work in current occupation due to illness or injury. Okay, so from which date he was not able to work. Okay, that dates will go here. Box number 17 is the referring provider name. So provider is the common word used for everyone who is providing health related services. It includes doctor, nurse, compounder, hospital, ambulance, okay, physiotherapist, and all other facilities where health related services are providing. Okay, so at this point, just here we are considering that this is for the doctor. So name of referring provider means who is referring provider. So mostly the family doctor who is referring patient to visit our hospital, to visit our specialist to take the service. Okay, so that doctor's name will go here, who has referred patient to visit our hospital. Okay, and box number 17B is having NPI. So NPI means National Provider Identification. No. Okay, it's a 10-digit number all over US. Every provider, every doctor, every hospital, every ambulance, pathology, radiology lab, okay, every physiotherapist, everyone is getting one NPI, that is the National Provider Identification Number, and it will go here. So who have the doctor who has referred patient, his NPI will go here. It's a 10-digit number. Okay, and it's a mandatory thing. If you are mentioning the referring provider name, then NPI is also mandatory. If it is missing, then claim will get denied for referring provider NPI is missing on the claim form. Okay, so it's very important. Box number 18 is the hospitalization date, from which date patient got hospitalized in our hospital. That dates needs to be mentioned. It's not mandatory that these dates will match. Okay, so hospitalization date we have to mention here. Additional claim information. So we can see that every box is dedicated for some information. We cannot use that box for any other information, right? All 33 boxes are dedicated for specific information. So that's the reason they have given a additional box, the extra box, which can be used for any other purpose. Okay, so additional claim information. Example, I am attaching the medical record with this claim form, filling the claim form to insurance, also attaching the medical record. So I can mention like here, attached medical records with this claim form. Okay, any for any other purpose as well, we can use this additional claim information box. Okay, that is the box number 19. Okay, box number 20 is for the outside lab. So what is meant by lab? The pathology or the radiology lab. So it's not mandatory that in our hospital every time the facilities are available. If the hospital is big, then most of the time the pathology and the radiology labs are available. Okay, then that time it will mention as a yes. Okay, sorry, no. If in our hospital itself the lab is available. If patient is going outside, okay, generally what will happen if you are going to any doctor and he said that he needs some blood report, but the pathology is not available in his clinic or the hospital. What we'll do, we'll go outside any pathology lab, and whatever list of report miss a test he has given us, we'll take those reports from lab and we'll come back. Then doctor will read those reports and then only he will prescribe. Same here, if the facility is not available for radiology or the laboratory pathology, then the patient will go outside and they will take a service from outside lab. So maybe obviously it is not free of cost. So maybe he will spend some amount there. Okay, that amount needs to be mentioned here. Sometime under the policy, those charges are getting covered. So what happened? Whatever is the lab, they will bill the claim form to insurance for that patient. Okay, so here we just have to check whether any outside lab charges are there, then yes, or else no. Okay, if yes, then charges are also needs to be mentioned. That is the box number 20. Box number 21 is the diagnosis code. So what is meant by diagnosis code and all, we'll see in detail in our coding sessions. At this point, just remember the diagnosis codes are mentioned in box number 21. So there are almost 12 boxes here under the 21. So that is 21A to ABCD up to L. So these ABCD are the pointers and actual pointers are going here. We will discuss that. Box number 22 is the resubmission code. So in case we already build our first claim, first time we build our claim. So that first time billing the claim is called as fresh claim. That means to any insurance. Okay. Example, this is our PMS and this is the insurance company. Okay. Practice management software and this is the insurance. And if you are billing first time any claim from the insurance, from our software to the insurance. So first time billing the claim, that means CMS 1500. So first time if you are billing, that means the fresh claim. So it will go with the 01 code. Okay. But in case we already build our claim form with 01 and insurance has denied that due to some reason, maybe one procedure code has been denied. Okay, this is denied. For example, DX, that means diagnosis code. So what we'll do, we'll take help from our coding team and we'll resubmit the claim form. Again, we'll resubmit, right? So if we are resubmitting by doing some corrections, that time we'll bill as a corrected claim. So that time the code will go as a 07. Okay. So that code will go here if we are doing any correction, or else it will go first time it will go as a fresh claim 01 or else 07 for corrected claim, and the original claim number reference number means here we received the denied EOB, right? If insurance has processed and denied, then EOB will receive that, and on the denied EOB
claim number is mentioned, that claim number will go here as the original reference number. Okay. So in case if you are submitting by doing some correction, that time we have to mention 07. And so in our application actually we are just selecting the option as a corrected claim, and that's the reason the code is going as a 07. Okay. So box number 23 is the pre-authorization number. So what is meant by authorization? So pre-authorization means taking permission from the patient's insurance for providing a particular service. Okay. So in our RCM cycle, we saw that here, first of all, patient appointment is there, eligibility and benefits verification is there. Actually, third department is the authorization department. So their task is to reach to the insurance company and ask them, we are going to provide this surgery to the patient in next 3 4 days. Okay. And is there any need to take the authorization? That means the permission. If authorization department is saying that yes, there is a need to take the authorization, then there every insurance company is having different way to apply for authorization. Some insurance company we have to fill their form and submit. At some insurance company we have to fill the information on their web portal and submit. Okay. And at some insurance company on call itself we can get the authorization. Okay. So we'll get one authorization later. Okay. We'll discuss later in detail about the authorization, but the number will get, the authorization number will get, that authorization number will go here on this claim form. Okay. In box number 23. Okay. It's the important box. You can face in the interview question. Okay. Box number 23. So you have to tell the, it is used for the prior authorization number. Okay. Prior pre-authorization or prior authorization, why it is saying, like before providing service we are taking the authorization. That's the reason it is called as pre-authorization. Sometime if we miss to take the authorization and after providing service we are applying for the authorization, that time it is called as a retro authorization. So this is the box number 23. Box number 24 is long, like from here to here. These many boxes are coming under box number 24 only. Okay. So box number 24A is the date of service, on which date, like April 17 and then 25 to April 17 25. This is the date of service. Box number 24B is the place of service where service has been provided. So what all are the codes for the place of services? We'll see that so many place of services are there, like office visit is there, inpatient hospital is there, outpatient hospital is there, skilled nursing facility is there. Okay, so all these place of services in detail we'll cover in our coding session. Okay, this is for the emergency department. Box number 24D is for the procedure code. So it's a 5-digit code for every service. Some procedure codes are there. Okay. So example 99211. This is the one of the procedure code for evaluation. That means the general checkup. So we know that every time doctor will do some checkup before providing service, right? That code is 5-digit code. So our coding team is entering those codes and they are going under these boxes. Okay. Box number 24D only. Additional box is there in front of procedure code, that is the modifier. It's not mandatory. Okay. But sometimes if we want to give the additional information, then that time we are using that. Okay. For example, this is the x-ray code we are billing, and x-ray is for the left hand, so we can use the LT modifier. So what is meant by modifier and all, we'll see that. So modifier is nothing but the additional information for the procedure code. Okay. So actual diagnosis code are present in the box number 21 and their pointers are going here. So example, for this procedure code, diagnosis code is a mandatory thing. Whenever we are billing any procedure code, the related diagnosis code are mandatory to bill on the claim form. So actual diagnosis code are under box number 21, and here it is mentioning only the pointers. So I am mentioning here as a B. That means the diagnosis code for this procedure code is present under the B. Multiple diagnosis code can be there. Okay, BAA like this. Okay, these are the pointers for the diagnosis. These are the charges. Okay, for example, here $200 is the charge. Box number 24G is the days or units. So example, only one unit I have given here. I have mentioned as a 2 units for the X-ray. Okay, and it is for $400. Box number 24H is for the specially used for the family plans. Okay, that is dedicated for that, or else it will go as a blank only. Box number 24J is very important. This is the rendering provider. First of all, we saw about the box number 17, that is the referring provider, right? So who has referred to visit our hospital or specialist, that doctor's name is nothing but the referring provider. Okay, referring doctor. So rendering provider means who has actually performed service to the patient. That doctor's name, sorry, no, not the name, the NPI is going. It is also 10 digits. Okay, so the rendering provider NPI is going here. Okay, by entering the rendering provider NPI in Google also, many websites are there from where we can easily get the doctor's name. And in our application itself, if you are opening the medical record, clearly the rendering provider name is mentioned. In our application also, sometimes some fields are there to see the rendering provider name. Okay, now box number 25. It is for the tax ID number. It's a 9-digit number. Okay, one, two, three. How we are having the PAN card number in India for taxation purpose? In US, they are having tax ID number. So every person, every facility, every hospital is having their tax ID number. So if we are billing the claim for under the hospital, that means the payment will come to the hospital account. So that time the hospital tax ID number go here. If you are working for individual doctor, then the individual doctor's tax ID number will go here. Okay, next boxes are like social security number or the EIN number, that we'll discuss later what is meant by it. But at this point, just remember box number 25 is for the tax ID number. Box number 26 is for the patient account number. So here, whenever patient is booking the appointment, if he is coming to our hospital first time, there is no record in our software. So that time, whoever is booking the appointment for that patient, he will create a account in our application. But if the account is already existing, then every time he is not going to create a new account. The same account will be used, only the new visit will be added under the same account. So account number is the unique account number for every patient in our application, and that account number will go on the claim form, so that if we received any EOB, then our payment posting team will post that into the correct account. Consider that we are having 2 or 3 Smith William patient names. So once we receive the EOB, it is hard for the payment posting team to identify to which patient payment came. By mistake, if they posted in wrong patient, then so that's the reason this box is designed here. And whatever account number is generated in our software, it will go here. And whenever insurance company is creating the EOB, that this account number they will mention on the EOB. So it is easy to post that. And sometimes electronic EOB gets posted automatically into the software. So this is very important. Then only it can be posted automatically into the correct account. Okay. Box number 27, it is just for the terms and condition. Always go as a yes. Box number 28 is for the total charges for all the procedure code. Box number 29 is for the amount paid. Maybe patient has paid some advance amount, $100. Maybe we are working on the secondary insurance and primary insurance has paid some amount. So that go will here. Okay, box number 30 is reserved for NUCC. So ignore that. Box number 31 is the signature of the physician or supplier. So here also the physician, that means the rendering provider, Digital signature will go here. Nothing is manually. And on which date he signed, that date will go. Box number 32 and 33 are very important, and we should not get confused between these two boxes. So service facility address means where the service has been provided. Okay. Might be possible that our hospital is having 5 branches in a city. Okay. So in which branch, on which address service has been provided, that address will go here. And for that facility, for that branch, there will be a separate NPI number. It will go here, 10-digit number. Okay. And the billing provider information means for all the branches, may be possible that we are using only one branch, or maybe we are having the separate address or the office where we are using that as a billing office, billing address, where we are receiving all the EOBs, all the payment checks. Okay, all the documents are receiving on the single address. So that address will go here. If such kind of different address is there for our billing, then both the boxes are having different addresses. If the hospital where service has been provided, it is same considering as a billing, then it will go same address. So depend on the client on which you are working. If they are having different address for the billing, then the different address will go. Okay, so for that as well, as I said, 5 hospital branches are there, and one branch is considering as a billing address, and the service facility where the service has been provided. So both can have the different NPI. Okay, so these are some important boxes from the CMS 1500, and I have already mentioned in our notes which you have to remember uh, for the interview. No? So box number 1 is the insurance names. Okay, 1A is the insured ID or the subscriber ID or the policy ID. 17 is for the referring provider name. 17B is for the referring provider NPI. It's a 10-digit number. 19 is for the additional information. 21 is for the diagnosis code. 22 is for the resubmission code. So 01 is for the fresh claim. 07 is for the corrected claim. 22A is for the original claim number. If you are submitting corrected claim, in that case only the original claim number will go here. Okay. Box number 23 is for the authorization number. Okay. If we have taken any authorization number or letter, then it will go here. If we miss to mention that, then we'll get a denial as a no authorization. 24J is the rendering provider NPI. Okay. Who has actually rendered the service. Okay. Rendered means performed the service. Box number 25 is for the tax ID number, and box number 32 is for the service facility address, and box number 33 is for the billing facility address. Okay, so at least you can remember these boxes, and definitely in every interview they will ask you one question on it. Randomly they will ask you some boxes, 3 4 boxes, and you should be able to answer for that. Okay, so this is about our third session. From tomorrow we are going to start the terminologies. Maybe for the next 2 or 3 days we'll take the terminologies. So very important terms to understand, and many times we'll use in our real live work, and many concepts we are uh, uh, which are help us to understand the denials. If I am using any word while uh, explaining you any denial, so that time it is very important to know that terminology, then only you can understand the denial. So here consider that we are creating in first notes we are creating your base to understand the denials. Okay, as I have showed you, I have created these many notes. So first notes is for creating your base. Second notes actual we are applying for the denial management as a AR. So we'll cover almost 25 denials there. And then box notes 3 is having real time EOBs and the flow. for each and every scenario in detail we'll see again. And then box number sorry notes 4 are having calling part, how we are going to call to the insurance, scenario wise question and answer will be there. Okay, and notes 5, after joining, once you get the job, what will happen, those things is mentioned in this notes. Okay, so everything will be shared with you, don't worry. For today I'm stopping the recording here. One second.